Now let's look at the changes in the ovary after ovulation or fertilization. A surge in luteinizing hormone at the midpoint of the reproductive cycle causes ovulation. Now, after ovulation, a small amount of bleeding from the capillaries in the theca internus layer occurs into the antrum, which results in a formation of a blood clot known as corpus hemorrhagicum. You can see a hemorrhagic core here. Now, both granulosa and theca interna cells, they continue to grow and form a mass called corpus luteum, which is outlined here. This corpus luteum consists of theca luteal and granulosa luteal cells, and it's a very vascularized structure located in hazy section through corpus luteum. And what you're looking here are granulosa lutein cells and theca lutein cells. Now, granulosa lutein cells are large cells, and they are derived from the granulosa cells, while the theca lutein cells, they are small, deeply stained, and they are derived from the cells of the theca internal layer. So if fertilization and implantation occurs, the secretion of HCG will keep the corpus luteum alive. But if fertilization and implantation do not occur, the corpus luteum begins to degenerate about 10 to 12 days after ovulation. And it undergoes a slow involution. The cells become loaded with lipids and decrease in size, undergo autolysis. The remaining extracellular material persists as a white scar known as corpus albicans, and which slowly disappears over the period of several months. Now let's look at the changes that occur in the oocyte during development. At puberty, the oocyte in the primordial follicles is arrested prophase stage of the first meiotic division, and it is referred to as a primary oocyte. Now, if oocyte is ovulated, the first meiotic division will complete. Now, during this division, an unequal distribution of the cytoplasm result in a formation of the first polar body, which contains half of the nuclear material and a very small amount of the cytoplasm. Essentially, all of the cytoplasm remain as the oocyte. Now, this oocyte is now called as a secondary oocyte. Now, if this secondary oocyte is fertilized, the meiosis is complete with the formation of a second polar body. Now, both the polar bodies, primary and secondary polar body, they are found under the layer of the zona pellucida. As we discussed before, very few ovarian follicles are destined to complete their maturation, right? And most of the follicles, they degenerate and disappear through a process called atresia, which is mediated by apoptotic death of the follicle and the oocyte. On this slide, you can see some atreatic follicles. Now let's look at the structure of the oviducts or fallopian tubes. These are paired tubes that extend bilaterally from the uterus towards the ovary with no permanent attachment to the ovary. Now, the mucosal lining is simple columnar epithelium with both ciliated and non-ciliated cells. You're going to look at this structure in the histo lab in more detail. Now, ciliated cells are more numerous in the infundibulum area, where the wave of the cilia is directed towards the uterus, so as to capture the oocyte and move it towards the ampullary region. Non-ciliated cells, they are secretory in nature, and that produce the fluid to maintain an environment to keep the oocyte alive during fertilization and towards its movement. The epithelium of the oviducts rest on a lamina propria, forming a mucosa which is highly folded, as shown here. So here's a section of the oviduct through ampullary region, and you can see folds of the mucosa. The surrounding the mucosa is a smooth muscle layer and called the muscularis. The muscularis is organized into two layers, the inner thick circular layer and the outer thinner longitudinal layer. The boundary between these two layers is often indistinct. The outermost layer in the serosa, which is the part of the peritoneum lining of the pelvic cavity. Now, each uterine tube is approximately 10 to 12 centimeter long and can be divided into 4 segments going from ovary to the uterus. Now, these parts are infundibulum, ampulla, isthmus, and intramural. Now, infundibulum is the funnel-shaped segment of the tube adjacent to the ovary, and it has finger-like extension called fimbriae. The ampullary region is the longest segment of the tube, constituting about 2/3 of the total length, and is the site of the fertilization. Isthmus, which is here, is the narrow medial segment of the uterine tube which joins to the uterus. The intramural part lies within the uterine wall and opens into the cavity of the uterus. Now, just before ovulation, the contraction of muscularis causes the movement of infundibulum, and it's a fimbriae over the surface of the ovary. Now, the oocyte and the spermatozoa are basically transported through the oviduct by peristalsis of the muscularis and movement of cilia. And these processes are under the control of hormonal secretion. In addition to this, the oviduct plays a very important role in capacitation, storage, and selection of the spermatozoa. Here you are looking at the lumen of the oviduct, which is lined by a simple columnar epithelium. And this epithelium is composed of ciliated and non-ciliated cells. Now let's look at the structure of the uterus. The uterus is a hollow pear-shaped organ located in the pelvis between the bladder and rectum. The uterus is divided into two regions, and the body, which is the large upper portion of the uterus. The second is the cervix part, which is a lower cylindrical part of the uterus and connects to the vagina. The wall of the uterus is made up of 3 layers. The outer perimetrium, which is the outer layer of mesothelium. The middle layer is called myometrium, is the thick layer and consists of highly vascular smooth muscle cells. The inner layer is called endometrium. Now, during pregnancy, the myometrium layer expands by hypertrophy of individual smooth muscle cells and increase in the number of these cells as well as in the increased secretion of collagen by fibroblast. Now, after parturition, the uterus returns to the almost its original size with a thicker myometrium and larger cavity. Now let's look at the structural changes that take place in the innermost layer of the uterus, that is endometrium. The endometrium is a simple columnar epithelium with connective tissue. Now, the endometrium goes through extensive changes during the reproductive cycle, and these changes are synchronized with the development of ovarian follicles. Now, during reproductive life, the endometrium consists of 2 layers or zones that differ in the structure and function. And these layers are functional layer and basal layer. Now, the functional layer is the thick part of the endometrium, and which undergoes the most dramatic changes in appearance and is sloughed off at menstruation. The basal layer, which is retained during the menstruation and serves as the source of the regeneration of the functional layer. Here you are looking at the endometrium of early pregnancy and a portion of the myometrium. The endometrium is lined by a simple columnar epithelium with a mixture of secretory and ciliated cells. The simple columnar epithelium invaginates into the underlying lamina propria, forming these uterine glands. The lamina propria, which resembles mesenchyme, is highly cellular and contains abundant ground substance. And there is no submucosa that separates the endometrium from the myometrium part. Now, the cycling changes of the endometrial layer during the menstrual cycle are represented by 3 stages, and these stages are proliferative, secretory, and menstrual phases. Here you're looking at the endometrium of the uterus and a very small portion of the myometrium. The menstrual cycle is a continuum of developmental stages in the functional layer of the endometrium, which is here. The very base part is called the basal layer of the endometrium. Now, the cycle normally repeats every 28 days, and during that, the proliferative phase occurs concurrently with the follicular maturation and is under the control of estrogens. Now, the epithelial cells in the basal layer of the endometrium, they proliferate rapidly and covers the area which is denuded during menstruation. Now, further growth of these cells, they form simple tubular glands, which we are looking here. And they appear large and pale due to the accumulation of glycogen. The proliferative phase continues until 1 day after ovulation, which occurs at about day 14 of a 20-day cycle. Now, let's look at the second phase, which is the secretory phase. And this phase is synchronized with the functional activity of the corpus luteum and is primarily influenced by progesterone. Now, what you're looking here is the endometrium layer. Here's the myometrium layer. The basal layer, also known as the stratum basale, and the functional layer is also known as stratum functionale. Now, epithelial cells during this phase, they rarely proliferate. And what you see here, the glands, they become more extensive and take a shape of corkscrew. You can see here the corkscrew-shaped glands. Lamina propria becomes edematous, and the spiral arteries which are present in the lamina propria, they become longer and more coiled. The details of these changes you can see in your lab, histolab sessions. Now, these glands, they start secreting glycogen and nutrient-rich material to support implantation, and they include interleukins and various growth factors. Now, let's look at the changes during the menstrual phase. In absence of pregnancy, corpus luteum degrades, resulting in the decrease in the levels of progesterone and estrogen. The menstrual phase results from this decrease in estrogen and progesterone. The spiral arteries, they constrict or close off, causing ischemia in the functional layer of the endometrium and the loss of edema in the lamina propria layer. Because of these, surface epithelium dies, causing rupture in the veins, and that's the primary source of blood during menstruation. Now, the tissue loss continues and only the basal layer remains. If pregnancy occurs, the cells of the endometrium, they are maintained by the continued production of estrogen and progesterone. The cells in the connective tissue, they become large and rounded and now known as decidual cells. The layer of the endometrium that contributes to the placenta is called the deciduous basalis, while the rest of the endometrium is called deciduous paritalis.